Next, we have our final presenter in this track, which is Raven Veal. It is my honor to introduce you to Raven Veal. She is a design researcher at IBM-Watson Health, and she holds both a PhD and a Master of Science in Public Health. She will share the grassroots effort, the design justice initiative she led to address racial health disparities through IBM-Watson Health's digital health products. And she will do so by providing a case study that empowers Black, Indigenous, and people of color participants to contribute their expertise and lived experience throughout the entire design process, from the initial planning to the knowledge transfer. All right, and Raven is coming to you live, so she will not be able to interact with you in the chat if you have any questions, but she will be here for Q&A after. Thank you, Raven, and feel free to take it away.
Awesome. Let me go ahead and blow up the presentation. Great. So good morning, good afternoon, good evening, based on where you are in the world. So I'm really excited to speak with you today about elevating diverse voices in research, which is a part of the work that we're doing within the IBM-Watson Health Design Justice Initiative. But before I get into that, let me tell you a little bit about me. So I think a Pinterest is worth 1,000 words. So I've taken a snapshot here for you all. I'm a design researcher for IBM. I've been a part of Watson Health for the past 3 years, and I have a background in psychology, behavioral science, public health, but I'm also very much a jambalaya of a lot of different things, as you can see here. I'm very much into Afrofuturism and applying speculative design to what I do. And one of the strongest motivations for that is due to a lot of the negative personal touch points and interactions I've had with the healthcare system, either personally or by proxy through the experiences of my loved ones. And I'm super passionate about reimagining a more holistic, compassionate, equitable system of care based on the perspectives and voices of those who are typically not heard, which brings us back to the topic for today, and elevating diverse voices in the design of healthcare itself. So the way that I've designed our discussion for today is in 4 parts. So first, I'll give a little bit of context on racial inequities in healthcare. In part 2, we'll cover a framework that we're currently working on at IBM, one component of that being related to inclusive research practices. In part 3, I'll take you on a journey across several different case studies, and then I'll end with a call to action and final thoughts. I've also embedded a few interactive components throughout, so for some pause and reflection, we'll be able to do that. I'd like to start with one of the quotes I find most powerful because of the truth in it. And that's, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane, stated by Dr. Martin Luther King Jr. Another quote that I find really powerful is by Dr. Donald Berwick, who's the former administrator of the Centers for Medicare and Medicaid. And he stated that every system is perfectly designed to achieve exactly the results that it gets. So there's definitely a dark side to medicine that has been designed since its origin. If we look back at the history of chattel slavery in North America, it was very clear that European medical practitioners served the interest of slave owners rather than the enslaved patients themselves. For example, physicians typically evaluated Black bodies for the sole purpose of demonstrating soundness for potential buyers and sellers. You also saw the practice of white medical schools and museums objectify the bodies of Black people after death, so using them as teaching materials. The image that you see here, kind of in the background, is infamous for depicting J. Marion Sims, or the quote-unquote father of modern gynecology, who perfected new surgical procedures by operating on enslaved women without anesthesia in the 1800s. So these are some of the origins of healthcare in the United States from one particular lens. And Black, Indigenous, and people of color in particular have experienced significant disparities as a result of racism embedded in the systems that impact both individual and community health. And over time, while many of these very blatantly dehumanizing practices have been eradicated, there are still systemic biases and inequities that affect our care today. So getting into the time machine, so to speak, and fast forwarding into present day, we see a similar type of bias in the encoding of racial discrimination in some of the more advanced healthcare technologies that we create. So for example, last year, there was a huge story that came out about a healthcare company that was using an algorithm to help hospitals identify high-risk patients. So people who have chronic conditions like cancer or heart disease. And they were essentially trying to help doctors identify who may need additional resources to manage their health. But it turns out that the algorithm itself was discriminatory, such that less money was being spent for Black patients with chronic conditions than white patients. What's interesting about this is that the actual algorithm didn't make explicit mention to race as a variable. Instead, it used previous healthcare costs as a proxy. So by doing that, it ensured that the people whose healthcare cost more in the past were also going to get more attention in the future, and that just so happened to be racially differentiated. Dr. Rua Benjamin, she's the woman pictured here. She's a professor at Princeton University, and one of my mentors, she calls this the new Jim Code. So this term references the Jim Crow laws, which enforced racial segregation in the Southern United States, and now that's happening in our technologies. She has a book out now called Race After Technology that goes into this into further detail. I would highly recommend reading that if you haven't. It's also important to note, and one principle that she emphasizes in the book is that exclusion doesn't have to be explicit. You just have to be indifferent to it. And I'll pause there because that point is really important, especially because indifference and apathy are arguably just as bad as being intentionally biased. And in many ways, it can make you implicit in the inequities that exist. So to that point, there's an incredible need to raise awareness and empower the designers of these new health technologies that we're creating for diverse populations to make sure that we're delivering equitable care and equitable experiences. And so that brings us to the enterprise design for racial equity, assessment. And I'd like to first define what's meant by racial equity, so we're all on the same page. So it can be defined as, the condition that would be achieved if one's racial or ethnic identity no longer predicted their outcomes or how they fared in a particular situation. And so this project actually started with myself and a few of my colleagues, amazing and talented Black women at IBM. I'd like to shout them out here: Andrea Barbrin, Sharice Cooper, and Morgan Foreman. And it was following the death of, George Floyd and the riots afterwards. And being Black women, we really wanted to understand, how can we use these technologies that we're helping develop to reduce some of the disparities that we see. For example, there's a really high rate of maternal death in Black women, right? How can we, the things that we're working on, how do we address that? And as more people kind of caught wind of what we were trying to do, we were encouraged to scale this concept and principle across all of our products, which is what you see here. So after several months of research and iteration, that brings us to the assessment. Again, the enterprise design for racial equity assessment, designed to raise awareness among product teams and provide guidance on how to be more inclusive, mindful, and considerate of racially diverse end users across these four main categories. So you have digital product design, design research, design for data visualizations, and then also design for AI. For the purpose of this discussion, we'll cover kind of that number 2 box, right? Some of the main tenets of inclusive design research practices, and that includes the following. So inclusive planning, racial diversity benchmarking, and then lastly, participatory analysis. So these 3 touch on some of the main steps in the research cycle, but the main principle really underlying all of these is to partner with the diverse communities that you're trying to serve in order to shape and inform the experiences that you're creating. And again, that's a part of being inclusive in your research approaches. And so let's go ahead and start with the first one, which is inclusive planning. So for this one, the goal is to really invite diverse research participants to scope your research agenda, your problem statements, and your research questions. So first, I'll start with just a case study of how we're starting to do this within IBM. The first example is very much related to the development of the framework that I just described. In the early stages of planning that, actually, we invited a varied group of design leads who would ultimately, take the assessment as well as some of our diverse clients across the globe, just to give us a perspective of, what are the most important things in the digital experience to account for. And then second, in some of our upcoming research efforts within Watson Health, we have what's called a sponsor user program. And in that, we invite the people using our technology, so that could include physicians, radiologists, some patients, to essentially co-create with us throughout, the research cycle. And two of the core initiatives for the year are, one, to improve the racial diversity of that pool of participants, and then two, to invite them much earlier in the research cycle to enable them to help shape our research and discovery. And in terms of why this is important, there are really two main reasons. So one, it gives members of that community an opportunity to plan and shape the context of the research up front. So what's most important to them, right? What do they see as the biggest unmet need or the problem to solve? And then how does that align with your expectations or objectives coming in, especially since those tend to be more business driven? And I think by asking these questions up front, you essentially maximize the benefit of the research, and then you reduce the potential harm that could result from not obtaining their insight and input. And then secondly, it helps deepen relationships between the researchers and the participants. And I prefer to call them partners, really. And it does this by placing us both on an even playing field as experts in our respective domains. And overall, it evolves research from just learning from people as, quote unquote, subjects of study, and makes it more about working side by side with them as co-creators and partners, especially at the start of a project. So because this is one of the items on our assessment, I'm going to try this, hopefully it works. I'd love to see how everyone else is doing as it relates to inclusive planning. And again, this is really just about raising awareness. So if you can, provide your response in Slido. So open up a separate browser really quick, type in slido.com, and then in there you can put hashtag diverse voices, and then we can follow up with more discussion at the end. But just kind of assess yourself quickly if this is something that your team does or not. And then we'll start to see some of the responses live. And I'll give it 10 seconds. Okay. Good to see some yeses in here. When we first did this, our answer was no, so no shame in that. Again, goal is to raise awareness. And then some unshures. That's interesting. So yeah, if you have any questions, keep those in mind or jot them down, and then we can come back during the discussion piece. Okay, so overall, this is cool. I'm so glad this is working. Okay, so majority we see not so much. So I want to kind of follow up with some ways to implement. And again, my goal is really to keep these as simple as possible to support adoption and implementation. So the research plan is your roadmap for success when you're embarking on a project. So one of the first things you want to do is schedule an initial planning session to present, your basic information, the goal of the project. This meeting is typically including your cross-functional team and your main stakeholders. And in it, you want to encourage discussion about the general ethical implications and considerations of the research work. Secondly, you want to invite 2 to 3 community members who represent the target demographics to this initial planning session. Prior to this, you've usually completed some secondary or prior primary research in order to understand who exactly you need to talk with and learn from for your research. So that should help you define who to invite to the session. And then lastly, you want to encourage critique. You want to empower those community members that you've invited to question everything from the project plan to the way that you're, planning on recruiting other community members to learn, the methods that you'll use, and especially the discussion guide if you're doing interviews with people. How do you navigate conversations about topics that could be potentially traumatic? What are the cultural considerations that you need to be aware of? These are important things to consider. So with that, we'll go into the second category, and that's related to racial equity benchmarking, or using screening criteria in an effort to overrepresent individuals from Black, Indigenous, or people of color communities. So there's an example of a Watson Health project that we recently completed this with. So we were specifically seeking to understand patient experiences within clinical trials. And that's a big thing now. And specifically, we wanted to know what may lead to someone dropping out of a trial, especially before the study is like formally completed or closed off. And if you weren't aware, there's a lot of underrepresentation in clinical trials among racial and ethnic minority groups due to things like lack of awareness. So providers typically don't recommend minority patients to trials as often as other patients. General mistrust of the medical system, and that's kind of based on some of the history I've described earlier. And then some logistical things like, lack of transportation, lack of time. So because of that underrepresentation, we were very intentional in wanting to overrepresent these groups, especially when it came to setting up our screening criteria so that we could have a healthy amount of understanding from this perspective. So why is this important? The concept of overrepresenting a specific group, in this case, racial ethnic minority group, is important in the context of researching topics or industries that have known underrepresentation or even harmed groups. As a best practice, being able to highlight voices at the extremes of the population provides the opportunity to serve the average better by focusing on the challenges of those who are most in need. And as an analog, we do this a lot, especially when we talk about things like accessibility and physical ability, right? And I think that I believe that this is another layer on top of that. And this should also be top of mind when creating benchmarks or goals for the distribution of your research sample. And again, because this is one of the items on our assessment, I'd love to see how everyone is doing as it relates to racial diversity benchmarking. So again, take some time to provide your response here. And we can also follow up with more discussion at the end if you have any additional questions. All right, love to see some yeses in here, a lot of no's, a couple maybe a little bit unsure, okay. And if you are selecting unsure, I'd really love to hear from you in terms of, what influences that uncertainty. So hopefully that comes out in the discussion. Okay, got it. So similarly, in terms of how to go about implementing something like this, here are some approaches. So, one, when possible, modify your screening quotas to have minimum thresholds for your underrepresented groups and then maximum thresholds for people who are adequately and overrepresented. So what does that mean? If we go back to the example of the clinical trials, right? So African Americans currently make up about 13% of the US population, but only 5% of trial participants. So in our study, when we were establishing screening criteria, we wanted to aim for at least 20% of our research sample to represent this group, again, kind of getting to that context of overrepresentation. By contrast, white males make up a larger percentage of trial participants. So we wanted to limit that group to about 20% of our sample or less. And the idea here isn't to exclude anyone, of course, but to emphasize and prioritize those voices that are not normally heard. And then second, you have to have some way of getting that data, right? So you're going to be asking demographic questions in your screeners, but it's important to make sure that these questions are optional and non-coercive. So, using multiple choice options where people can select multiple ethnicities or choose not to answer primarily because of, their previous abuses when collecting this type of information. Some people collected it without any real purpose, intention, or use for it, more for surveillance, and we, of course, don't want to do that. But if it is something needed to adequately answer the research questions that you've identified, it's important to make sure that making that effort is critical. And it involves going just beyond selecting people solely because they're readily available or convenient to reach. And then lastly, this last category here is related to participatory analysis. So this involves bringing in multiple perspectives and experts in data analysis that acknowledge how race and larger systems of influence might influence and impact those outcomes. So this is something that, in full transparency, we have not done yet, to the best of my knowledge, within Watson Health. My hope is that this will become a more common practice, especially because there are so many historical and systemic influence on health data that we can become more conscious of being aware of. However, I do have an example related to IBM's launch of the Racial Equity and Design Initiative last year. So one of the goals of that research project, or one of the research projects within that work stream rather, was understanding how Black and non-Black designers communicated around topics of racial equity in the workplace. So what were the challenges, and then how did those challenges affect feelings of psychological safety or mental well-being, both of which affect work performance. And during the analysis of the information and the data we received, I actually held a workshop with other Black and biracial designers, as well as consulting with other researchers who were really great at pulling the jewels out of qualitative insights and stories. And overall, I have to say, it was one of the most exciting projects that I've been a part of, mainly because the interpretation of the data was so much more richer, right? So defining and distinguishing what racial equity means for someone who's biracial versus someone who's an immigrant versus someone who grew up in this country. And then as a result, the recommendations that came from it were just so much more true, if I can use that word. And to summarize why this is important and why I love doing analysis with other collaborators is because, one, analysis makes the team stronger. So your group feels like they at least understand the basics of the data that were collected, and it empowers them to collaborate on insights. And then two, kind of flipping it around, the team makes analysis stronger. So even if you do kind of the research alone, you want to be able to see if the data has more to tell you than what you've been listening for. And to that last point, incorporating a racial equity lens during this process means understanding the individual context, the community context, the historical context of race, to clarify the patterns that you're seeing, as well as helping to inform the conclusions and recommendations. And also, given that, it's important to have strong participation from a variety of stakeholders. So this is the last item on our kind of mini assessment, mini group assessment. So go ahead and take some time to respond to how you're doing as it relates to participatory analysis, and then I'll follow up with some key points of implementation. Nice. This one seems a little bit more straightforward. So no unsures or uncertains here. Yes or no? Okay. Got it. Got it. Okay. And then again, here's some three just high level points to kind of take away in terms of how to implement. So one is engaging both domain and methods experts. So you can do this in a workshop, you can consult individually, or do a hybrid of both. But again, kind of bringing those multiple perspectives in will help eliminate some of the potential bias from being the sole interpreter or analyzer of the stories and data that you've collected. Secondly, using a mixed methods approach is helpful. So this technically comes in earlier in the process when planning, but it's helpful to have both stories and numbers when you're trying to understand the lived experiences of those that you're trying to serve. And then lastly, consider both the individual and historical context of identity, especially when you're analyzing these lived experiences. So we're talking primarily about, race and ethnicity as one component of identity, but also consider disaggregating data and analyzing intersectional experiences. So looking at race by gender, or the differences between, Hispanic women and Hispanic men. Those things are also kind of important to consider how these identities have changed over time in the interpretation of the findings. What does it mean to be Black versus biracial versus, there are so many varied experiences, there's not just one. So without doing this, you can unintentionally gloss over inequities, which lead to these invisible experiences that go unacknowledged. On the other hand, there is kind of a trade-off in the sense that you could be shifting the focus of analysis to a population that's already over-researched. So again, it's important to be mindful of those trade-offs, and that's also why it's important to kind of have methods experts involved in the process to help and support with that. So with that said, those are the three main principles of inclusive research that I wanted to highlight for today. And to conclude with just some final thoughts and to further emphasize, the time is now to apply an inclusive lens to the way we conduct design research in healthcare, and to just elevate diverse voices and perspectives in the design of new health experiences. And before I go directly to discussion and opening up for questions, I'd love to make a quick shout out. So IBM has launched an initiative, as I mentioned kind of earlier, around advancing racial equity in design. And I'm one member of the really great leadership team for this effort. And our ultimate goal for this is to make sure that racial equity is instilled in every aspect of our design culture. And one important facet of that is recruiting, hiring, and retaining underrepresented minorities, Black, Indigenous, and people of color designers into design positions. To support that effort, I led a team in developing this great field guide to support design managers and leaders in this effort. So if you have the time, please check it out at the link below. The E, I don't know what happened to the E, but if you can read it, it's ibm.biz/equity-fill-guide. It should take you directly there. And with that said, I will open it up for discussions and questions. And actually, I'm gonna stop sharing my slides so I can see.
Amazing! Oh, thank you so much. There's so many questions, such good discussion, connections happening in the chat as you were presenting. We're gonna go a little bit over. Normally we have like 10 minutes for questions. I'm gonna go with 15. So if folks wanna go to the lunch and learn, just be prepared that this is gonna go 15 minutes because we have a lot of great questions and I wanna ensure we get to it as much as we possibly can. A quick thing, you know, throughout you were talking about, you were making a few tweaks in your language that I noticed and picked up on that I think is so important, right? This idea of partners versus participants, this idea of talk with versus talk to. It's like, ooh, that's a small thing, but I noticed it because that's so important, right? It's not that we're extracting information from people, it's that we're including them. We are doing it with them. And then, you know, lastly, and I told this to you when you were presenting me the rough draft, like the idea of overrepresenting, like that's what we have to do, right? And people sometimes may say, well, that's reverse racism. And I'm like, is it though? Let's think about what we're doing here and why we're doing it. And if you think this is a problem, maybe you should be the one to think about why you think that.
Yes. I think to that first point, especially, I am always trying to tweak my language because like you said, it's like, putting us on an even playing field. There's a lot of power dynamics that happen between, you know, researcher and participant, and it's really, we're both bringing something really valuable to the table. So I really like to kind of tweak my language to keep myself mindful of that and to just evolve in this next, you know, this next evolution of inclusive research. What I call it.
Yes, I love it. People were really excited about this. Someone said this is a breath of fresh air. love the recommendation of involving community members in the research planning. Can't wait to take this back to my team. One question was around any tips on navigating power structures between researchers and participants, right? How do we empower folks to question everything?
Yeah, I think that just comes with practice, really, right? Especially for me, and I'll speak for myself, especially when you're trained as a researcher, a lot of those power dynamics are embedded in the training, and I came from academia, right? So being able to kind of break the cycles of that a little bit, it starts with language, it starts with, one of the first principles is inviting people earlier on, right? Normally we wait until maybe the middle of the project or even at the end when we're doing more evaluative stuff to bring people in, but really acknowledging them as partners starts at the inception of a project. So being able to start there and then practicing, taking a seat to their expertise, right? They're experts in their lived experiences and their culture and their community, and being able to honor that. It requires a lot of humility. Of course, as researchers, we bring a certain level of expertise, but we don't know everything. And so it's important to continuously realize that in yourself. And again, just honor the expertise of the partners that you're bringing in with you.
Mm. Yeah, that's a great answer. Really, especially for me as a person who's white, mostly cis, I hold a lot of power and privilege, and recognizing like when I have to give that up, which is most always, and being comfortable with that, right? Because we're not socialized as white people to say like overrepresent folks of color. Well, we have to do that because we have this horrendous history that we are all we all need to kind of actively work against, right? I love that part around, oh, well, if you're just a passive bystander, you're part of the problem, right? My mind goes to like, ooh, white silence is violence. Like, ooh, that creates a visceral experience that really reminds me of that same sentiment. And you did it in a much more palatable way to really help people understand that if you're not actively working against something, you're part of that problem.
Yes, yes. Plus 100, emphasize that point. Don't be passive, don't be apathetic, don't be indifferent.
Yeah. Woodrow had a few great comments. One, he wants to be involved in this initiative. So you two should connect.
Okay. Reach out.
You both share a love of Afrofuturism, so I'm sure you'll have a lot to talk about. One of the things he said was around looking forward to this discussion around methods to support understanding, and also, you know, those design education implications. Just going to put that comment out there. If you have anything to respond to it, feel free. If not,
yeah, I'm actually looking for that. So if you can provide clarity around that, I'd love to answer. So I just heard kind of methods of implementation, or what it's specific. Yeah.
He actually has a question he had 1 second ago, so I'll ask you that one.
Okay.
In terms of engaging with community partners, what specific tools and techniques have you engaged with to obtain input and insights? It was so awesome to hear you mention Afrofuturism. Have you used tools such as vision concepting as starting points, or as a means to share and build vision?
Yeah, so there's this really great workshop I like to do about kind of strategic visioning. And it involves kind of thinking about all the different implications of a possible future that you want to create. I like starting with the end in mind and kind of working backwards. And this is more so kind of when you're kind of getting into that making phase of, you know, you have some insights and now you're trying to figure out what to do with it. And being able to invite people, especially diverse, you know, participant partners. See, I'm challenging myself.
We're doing it.
Into that experience is amazing. And being able, especially like with the Afrofuturism, I haven't had the opportunity to integrate that component yet. I have some plans to do that in the future. But this, the workshop essentially kind of enables you to think about a possible future and all the different implications of that. So for example, like what are the political implications, economic implications, technological, thinking about holistically both the intended and unintended consequences of this new thing that you're trying to develop. And again, taking those kind of diverse cultures and backgrounds into consideration, into imagining that possible future. That's one technique that I think would be pretty useful in being able to go back to the question and engaging with different community members. So yeah, let me know if you have any other questions about that.
Yeah, that sounds a little bit like a pestle scan. Is that what you're talking about?
A pestle scan. I actually had not heard that before.
You just described what it is to me. So I'm pretty sure that's what you're doing. Yeah. But if not, I know that there's different acronyms for that in future studies. Okay, another question. How do we do this in qualitative samples that may be quite small?
That's a good question. That sounds like one that I'm going to have to think about a little bit more. So how do we do qualitative? And when you say do this, I'm assuming that you're talking about, again, kind of partnering with diverse, you know, participants in the study.
But Rachel can correct us.
Yeah.
Right.
Yeah. If you want to clarify, that's fine. But I think the same principles apply, whether it's kind of a larger sample and you're doing more quantitative work. I think it may be a little bit easier to do, arguably easier to do if you have a smaller sample, because of kind of the recruitment, you know, typically recruitment takes the longest to do. So if you have a smaller size of people that you're working with, if you're doing focus groups or interviews or things like that, again, it kind of may be easier to navigate and recruit the required number of diverse samples in order to kind of, you know, tease out the rest of your research process. So. Yeah, but let me know if you had a more kind of specific question around that or clarify if you need.
Yeah, Rachel just said about quota sampling. So how do you use quotas in small samples? So I think it was around when you were saying over representing different groups.
Yeah, that's a really great question. Let me chew on that one. And I can.
That is allowed.
Yeah.
Okay, we have a few more. Let's see. What are the skill sets needed to become, you know, to do such work? There was another request of like, how do I get involved? And what are the skill sets needed to do this type of work?
Yeah, I think, so I'll go with the last one. So as I mentioned in the presentation, the assessment itself is not yet publicly available, but we do want to make it, again, accessible and available for people to, use in their work and to help break, refine, iterate, things like that. And then as far as the skill sets that you need to be able to do this, I think I'm going to lean more on the softer skills of being able to be humble, being able to be collaborative, knowing how to interact with different cultures. One of my strongest beliefs is that kind of cultural intelligence is the new strategic advantage. So knowing how to talk with and honor people who come from different and diverse backgrounds, knowing how to state that when you don't understand something and being able to follow up for, clarity in a respectful way. I think those things are super important from a character perspective, soft skill perspective, when engaging in this type of work. I would say more so than the hard skills.
I appreciate that a lot as someone who passes as an American. I appreciate that a lot. Here's another question. How do we do this if it seems that the stakeholders themselves are not racially diverse?
Ooh, I love that question. That's a question that I'm asking myself internally as I'm trying to push to do this work in the organization that I'm currently in. And I feel like it starts, if there's almost like a funnel, right? Like what I've talked about is kind of advancing racial equity in the design of our products and technologies. Further upstream, there's a really huge challenge of getting more diverse people on the teams, right, in the doors. And so I think that's we're trying to do these in parallel, but I really think that first piece is super important. To your point, getting more diverse stakeholders makes the other part a lot easier. But if you're in the state where you don't have that, it's just going to be a lot of education, a lot of raising awareness, a lot of emphasizing the importance of this. IBM has unfortunately had some public, bad things happen as it relates to technologies that have been racially biased. So it's almost as simple as bringing back up those case studies and saying, we don't want this to happen again. It shouldn't have happened in the first place. And we need to make sure that this, that we're doing things to prevent that. So again, just a lot of education, raising awareness. If you don't currently have diverse stakeholders who I guess understand the importance of it.
Yeah, it reminds me of when people say, well, there aren't enough people in the pipeline. And I'm like, well, are you doing anything to change the state of the pipeline? Like, what is your organization doing? Do you have internal talent development programs? Are you going to organizations and grassroots efforts like Where Are the Black Designers, which is a great Slack team that has a lot of Black designers? Yeah. One kind of shout out is that, we don't want to just hire diverse people and put them in toxic white supremacist workplaces. So before you hire someone who is of a racially diverse background, ensure that your workplace is inclusive and of differences, because otherwise those people aren't going to work for you.
100%. A lot of people don't realize that retention, everyone talks about DEI, right? I like calling it DIBS because it has the belonging piece in there. Like, do we have a sense of belonging, like in the organization, in the culture? And we mentioned that in the field guide that I mentioned, but yeah, 100%.
Yeah, I linked to it because I know in the field guide there is a whole area around how to build that pipeline, because you're talking about intersectionality. You're saying, okay, great, we're working with partners that are racially diverse, but we're also recognizing that tech has a problem and design has a problem, like most other industries.
Yeah.
Okay, there's one more question about your specific journey from public health to the design work you do today.
Oh my gosh, thanks for that question. So my journey, oh my gosh. So I definitely I'm very passionate about healthcare. And my journey, I think, was inspired by, personally, no shade to anybody in academia, but I didn't want to stay in academia. I wanted to do something that I felt like had had a faster timeline and could really, I could see the direct impacts of what we were creating in the community. Not that you can't do that in public health, there's a lot of great initiatives with that. But I was just really attracted to how technologies kind of could scale that care. And I was especially attracted to IBM's definition of AI. So it's often referred to as artificial intelligence. They had the mindset of augmenting intelligence. So it's not we're trying to replace the doctors or anything like that. We're just trying to supplement with the training they already have, and figuring out like how can we maybe evolve that not just to their intelligence, but to kind of their compassion, right, and bedside manner, and being able to influence that part of the relationship. So just really fascinated with that world. And again, I'm a futurist and Afrofuturist, so wanted to kind of get into the emerging tech world as well. So that's the short version.
That's great. I'm sure folks will want to connect with you offline to hear more about your journey, but people are really excited about this. And kind of one of the last things I will add, thank you, Woodrow, for that shout out. Also look at historically Black colleges and universities, right? So when you're trying to build that talent pipeline, are you looking at organizations like Howard? There's a group called AMY that's doing a lot of work with kind of bringing looking across different HBCUs and kind of bringing them into the design process so that they understand what it's like while they're still in college, right? Because to your point, the world of design is largely influenced by, at least in academia, older white men. So we learn a specific view of the world and how we're supposed to design, which comes from a place of supremacy. All right. Any last thoughts from you, Raven, before we close out the session?
That was a great end note. So 100% to that. Okay. Thank you.
Thank you so much for being here. Like I said, I am honored and humbled. Woodrow was saying awesome with 500 exclamation points, and everyone else is very, very thankful and inspired. All right. Bye, everyone.